Hello students, welcome to the channel. So today in this video we are going to discuss some important questions which is very important for your competitive exam. So here we have a first question is that the decreased risk of atherosclerosis is associated with increase in, and the options are: option A is very low density lipoproteins, option B is low density lipoproteins, option C is cholesterol, option D is high density lipoproteins. So students, atherosclerosis is like this. So this is your blood vessel, and in atherosclerosis condition there is a plaque formation, so that your blood flow get disrupted by this plaque formation. So this is your atherosclerosis condition. So in this question, the question asks like that the discrete risk of atherosclerosis is associated with increase in the high density lipoproteins. It means that when there will be increment in high density lipoproteins, then there is a decrement in atherosclerosis. So now moving on the next question. The anticoagulant heparin is obtained from, and the options are: option A is sheep's lung, option B is dog's kidney, option C is rabbit heart, option D is rat's uterus. So the anticoagulant heparin is obtained from, and the correct answer is sheep's lung. It is obtained from the sheep's lung. Now moving on the explanation part on this, that the anticoagulant heparin is obtained from the sheep's lung because heparin is present in all tissues, but mainly in lungs and liver tissues. This is mainly found in lungs and liver tissues, and it is also extracted from porcine intestinal mucosa or bovine lungs. Now moving on the next question. The mechanism of action of digitalis. This is your 2018 question, students, and the options are: option A is decrease intracellular sodium concentration, option B is inhibits sodium potassium ATPase pump, option C is the activates adenyl cyclase which produce CAMP, option D is decrease release of calcium from sarcoplasmic reticulum. So the mechanism of action of digitalis is the inhibits the sodium potassium ATPase pump, and it is a digitalis is a class of cardiac glycoside. Now moving on the next question, the digoxin option A is has its action terminated by metabolism in liver, option B is has a plasma T half of 6 hours, option C should be given half of its normal dose to hypothyroid patients, option D is provides beneath in atrial fibrillation by increasing the force of contraction. So what digoxin actually does, that it provides beneath in atrial fibrillation by increasing the force of contraction. Students, sometimes question ask that what actually digoxin does. So it increases the force of contraction. Now we have an explanation on this, that the digoxin provides benefits in atrial fibrillation by increasing the force of contraction, and elimination of digoxin is mainly by renal excretion, and an average half-life is about 36 hours, and its half-life is considerably longer in elderly patients and those with over renal failure in whom reduced dose are needed. Dose reduced is needed. So students, this is all about this question. Moving on the next question. The treatment of turmeric with concentrated H2SO4 gives, and the options are: option A is red color, option B is violet color, option C is green color, option D is crimson color. So when we will treat the turmeric with concentrated H2SO4, it gives the crimson color. So let's discuss with the help of explanation. Here we have a table form chart, so that turmeric with concentrated H2SO4 on treating it gives crimson color, which is the correct answer, and turmeric with concentrated H2SO4 or acid anhydride gives violet under UV light red color. And turmeric solution with borax solution gives green color. So students, try to note down these points. Now next question is that which of the following is not a pharmacologic effect of morphine, and the options are: option A is constriction of the pupil, option B is CNS depression, option C is diarrhea, option D is respiratory depression. So which of the following is not a pharmacological effect of morphine? So the correct answer is that diarrhea. Diarrhea is not the pharmacological effect of morphine. It means these are the pharmacological effect of the morphine, that is respiratory depression, CNS depression, constriction of the pupil. Now we have explanation on this, that the morphine does not cause diarrhea, instead of it causes constipation, means the pharmacological effect is constipation, not diarrhea. So pharmacological effect are analgesia, euphoria, sedation, respiratory depression, suppression of cough, nausea, vomiting, papillary constriction, reduced GI motility causing constipation, histamine release causing bronchoconstriction, and hypotension and immune suppression. Now moving on the next question, that the drug naloxone, and the options are: option A is produces morphine-like activity, option B is produces respiratory depression, option C is induces constipation, option D is precipitates withdrawal symptoms in morphine addicts. So the drug naloxone is precipitates withdrawal symptoms in morphine addicts. Now next question is: morphine is the drug of choice for, and the options are: option A is UTI, that is urinary tract infection, option B is colic pain, option C is bronchial asthma, option D is cardiac asthma. So in which morphine is the drug of choice? So the correct answer is colic pain. It is the drug of choice for the colic pain. Sometimes students, the DOC also ask in your competitive exam, so try to learn them. Now next question is estrogenic and prostrogenic combination mainly. Option A is inhibits of the ovulation, option B is inhibits the implantation of the fertilized ovum, option C is inhibits the fertilization of ovum, option D is inhibits development of endometrium. So what it actually does, the combination of estrogenic and prostrogenic? So the correct answer is that it inhibits the ovulation. Now next and last question of this video, students, an imidazole aromatase inhibitor which is effective in reducing estrogen level is, and the options are: option A is anastrozole, option B is exemestane, option C is mitotane, option D is dexamethasone. So an imidazole aromatase inhibitor which effective in reducing estrogen level is the anastrozole. So students, I hope you just like the video, so please subscribe and hit the bell icon or on our channel, so you will get notification when we are uploading the next video. Thanks for watching.